Good afternoon, everyone. We'll wait a second for folks to join. But yeah, good afternoon, welcome, and thank you for joining NYU CSAAH's 11th Biennial Asian American, Native Hawaiian, and Pacific Islander Health Conference. You are joining us for session 2, speaker panel session entitled Community Engagement Strategies to Sustain Health Equity Research Impacts. A friendly reminder, the session is being recorded, and just some housekeeping. If you have questions for our panelists, please feel free to add them to the question and answer box function at the bottom of your screen. And for the most part, I'll defer to our speakers to respond to questions either via chat or if they want to unmute and respond directly. This will be an hour session. We have some time reserved at the end for some Q&A. And lastly, we are happy to have a special guest with us who's attending this conversation this afternoon. Sarah Yukimoto Saltman is a graphic artist who will be offering graphic recording to help generalize and sort of build connection between some of the presenters' discussion points. And the final canvases that she is generating will be shared after this event. So just noting that she's on the line. So I will start by introducing today's moderator, who I am very honored to know and to have worked with, Dr. Sheri Daniels. Dr. Daniels is the CEO at Papaola Lōkahi, whose work centers Native Hawaiian communities and strives to improve the health status and well-being of Native Hawaiians through advocacy, partnership, and culturally appropriate strategies. So very pleased to have her here leading this conversation with our esteemed panelists. Sheri, I'll turn it to you.
Well, thank you, Jen. It's always great to work with you. And I'm excited to be sharing the work of our panelists with everyone on the call today. I hope everyone's having a great Monday so far, depending where you are in the world. It could be in the afternoon, or here in Hawaii, we're at 8 a.m. or 8:20 a.m. And so as Jen introduced me, I'm Sheri Daniels. I'm the CEO of Papaola Lōkahi, and it's an honor and privilege to join you all today. But let's get into it. We're going to really have some conversation about research and how that is, what those community engagement strategies look like for our communities, but also for them as researchers, some of the successes, some of the challenges, some of those like, ooh, how do we do this different? Kind of conversations. That's what we're having today. And so I'm going to popcorn it to our different panelists to introduce themselves. Who are you? And really, we want to know, what community do you bring with you today? And then we'll get into some of the deeper dive questions. But I'm going to start over with Stella. Stella, if you can introduce, and if you can popcorn it to your other panelists. We have a total of 4 of you folks joining us today.
Great. Hi, Sheri. It's nice to see you, and it's nice to see everyone on this conference today. I'm so excited to be here, and just listening to that first session, I feel really invigorated. So I'm Stella Yee. I'm an associate professor at the NYU Center for the Study of Asian American Health. My content expertise is on nutrition and cardiometabolic disease in Asian American communities. And I really liked how you wanted us to start out this panel, Sheri, and thinking about our communities and who we're bringing. I think about this actually all the time for myself, because I myself am a Korean American individual who grew up in New Jersey, and yet the coalition that I represent is serving Mexican and Chinese immigrants in Sunset Park, Brooklyn. And so I work with a coalition of 10 partners, social marketing and language justice consultants. But I think, like, for myself, and I raise this here because it is important to understand the different Venn diagrams of communities we're talking about. I think when I think about my own community, I think about my coworkers and colleagues and all of you on this call. I think it's when you're in such a space where everyone is devoted to health equity and diversity and inclusion, it's really easy to forget that not everyone is like that, and not everyone is working towards systems that help other people. And so I feel really honored to be a part of this conversation. I feel really honored to be part of this community, and then bring some of that collaboration and partnership into an actual community. So I will popcorn it over to Neen.
Thanks, Stella, and thank you, Sheri, and all my other fellow panelists for this panel today. Happy to be here. My name is Ngeen Lei. I am a Community Engagement Manager for the Asian and Pacific Islander American Health Forum, also known as the Health Forum for short. And when you were posing that question, Sheri, I was also kind of thinking on the same lines as Stella. So personally, I'm a second generation Vietnamese American. So working with immigrant and refugee communities within our larger like AA and HPI umbrella is really important to me. But the great thing about the Health Forum is we're actually one of the oldest and one of the largest health advocacy organizations serving Asian American, Native Hawaiian, and Pacific Islander communities across the nation, and also in U.S. affiliated Pacific jurisdictions. So one of my favorite parts of my role is getting the chance to work with, and just the opportunity to work with all AA and HPI communities through our national network of community partners. And I will pass it over to Shane.
Well, good afternoon, everyone. My name is Sheng Chen. I'm the Chief Operations Officer of the Asian American Health Coalition, BPA. We're operating as a clinic, a federally qualified health center. My background itself is healthcare administration, as well as working on various projects, community development, and policies. So with that, I'm actually born and in Taipei, Taiwan, and I came to Texas, Houston, Texas, when I was about 6 years old. And at that time, there was not a lot of focus on the AA and HPI, mainly because of how small the population is. And now, lo and behold, Houston is one of the biggest, most diverse cities across the U.S. And we are very multi-ethnic, but at the same time, are we equitable? Mainly because a lot of the AA and HPI is also just categorized into one lump category. And this is actually a great time and a great opportunity to have a conversation about what the segregated data means when it comes to researching. And if that actually would bring equity, because you're looking into all the different the culture, the diversity of the people's behavior, people's beliefs, people's food, people's the way of habits, and the way they you know, raise their family, and the way they actually interact with each other. So it's really critical time that we really need to look at how we're collecting data and how we're engaging each and every one of these population and community, and really work towards a more meaningful way of collecting the information and engaging the underserved population. And with that, I'm going to take it over to May.
Hi, everyone. Nice to see you. So I am a pediatrician and a community researcher at the Waianae Coast Comprehensive Health Center. So it's one of Hawaii's largest and the oldest federally qualified health center in Hawaii. I'm also faculty at University of Hawaii, the School of Medicine there, the Department of Pediatrics. And the community that I bring here are the communities of the Waianae Coast on the northwest side of Oahu, the main island in Hawaii. It's home to the largest community of Native Hawaiians actually in the world. And it's an amazing community of strong, resilient community members who've lived there for many who've lived there for generations. And it has really over the last many generations suffered from continuing health disparities, along with many other socioeconomic disparities. So I've shifted my work over time to really just work on ways that we can address those disparities.
Thank you, everyone. And to the question about the audio, I think we're trying to work with Shane. Shane, there was some folks who maybe couldn't quite hear what you were saying, so just FYI. But you know what I get from the four of you is I'm hearing about passion of equity, right? We talk about health equity, diversity, and inclusion, but it's really you guys all bring passion around the area of equity, which Stella, you're very right. We're often speaking to the choir when we're in spaces like this because we get it. We understand we're working with communities that are who we're talking about, or we're representing that ourselves. And so I think coming from that lens, absolutely we are there. But today we want to talk about the intersection of research and the research you guys engage in as research or as researchers based on your organization, and how that pairs or it weaves in with our community and how we engage community. And so I'm going to start with May. If you can describe, and for all of you, describe the process or your process from a researcher lens that you took to build a robust community engagement infrastructure. Because I think that's really important to talk about what that looked like for you, because I believe we're going to see some similarities, but we're also going to see some differences. And I think geographic, and I also believe our population, our communities play a role in how that looked like. So if you can take us through briefly what it took for you to do that, what were some of those positive unintended outcomes that you got, but also what are the lessons, what are those hard lessons that you might have experienced or learned from it? So May, I'm going to start with you.
Okay. And I'll try not to take too long.
So I'll wave when you start getting too long.
Okay. So I started as a pediatrician, an enthusiastic pediatrician, and quickly realized that there were many problems we were addressing in clinic, but not very effectively in our 15 to 20 clinic visits, where the problems were just getting worse over time. So for pediatrics, that was what was the most obvious to me was obesity. I had worked in other parts of the Pacific and had not experienced this problem with patients before, and I was not helping the patients to get healthier as they got older. In fact, it was getting worse and worse. And so from there, I went and learned how to become a community researcher, and started working with our health center staff on ways that we could try to address the issues beyond the clinic walls. And it was not without mistakes. So the way we in the medical community viewed a problem like obesity is not the way our community was looking at it. For them, many of the kids were just the right size because they were strong and robust, and being a larger size in a community that has all these challenges was an attitude we had to understand. And so from there, I began to understand the need in talking to many people across the state about the need for larger, more upstream ways to address the problem through research, but also programming. And so really, to make a long story short, over the last 20 years, we've really shifted to try to do much more community-led, community participatory approaches. And I know that those terms get thrown around a lot, and it's evolved over the last 15, 20 years. But it's taken me that long to really feel like we've got the partnerships and the trust to do that. And so from obesity, it's gotten to a larger viewpoint of addressing what are the upstream strategies that need to be changed, and how can we do that with community leading this. And so right now, the big project we're addressing, we did that with COVID. Now we're looking at youth mental health and the risk factors for chronic disease. And in working with the community, it's going back to what are those assets, those amazing assets within the community. So for us, it's what we call our AINA-based organizations. So AINA refers to land and our environment. And for Native Hawaiians and Pacific Islanders, that is a crucial part of well-being and is so often disconnected from health care, schools, and our general well-being. And so we are looking towards our AINA-based organizations to link that back to healthcare and health and well-being. And I know that's really kind of broad, and I can go into more detail later. But I think the things that have come up for me for equity is one, budget. So we always look at the budget and make sure that our budget is really focused on building community capacity, health center capacity to do the research. And we look at sustainability from the beginning and how we can sustain this. And then we are really working to build our research infrastructure, which we've done so over, the 15, 20 years that I've been working with. So it's always all the projects need to do that. And then definitely, how does community lead? And that's always a tricky question, but I think, and a tricky issue. So the last things, just very broadly, I want to put is showing up. So if we make an appointment, if we say we want to partner, we show up. And that might mean going to a meeting with one other person or two people when you expected 20, but you still show up. And my staff has told me that, during COVID, sometimes they would put on the schedule a testing day and then, various things would happen and we think about canceling, and the team always says, you got to show up, and we always showed up. The second thing is transparency. So there's no hiding things. We share with our partners budgets. We share with them results, and we try to be as transparent as possible. We're not perfect, but I think those are the two main things that have helped build the trust.
Thanks, May. I think you captured a lot of great things. Actions, right? Actions speak louder than words. When we just talk about simple person-to-person behaviors, actions speak louder than words. Being honest, communicating, and I think that's part of transparency. And I think that's moving to using your community as a community of culture, of practice. And that's what I'm hearing from you. And so, Shane, what about you? And I know you might have had slides. So do you want to use your slides?
Definitely. Here's one that I definitely want to share. It's still disabled, Jennifer.
Celine, can you grant her?
You are. Shane, you're co-host now.
So I definitely wanted to share that with the health centers movement. We have been working with the Federal Health Resources and Services Administration of the Health and Human Service Department, where the community health centers across the U.S. are now collecting disseminated data. And as you can see here, it breaks down not only just to the Asians, it actually also captures which ethnicity of the Asians that we are pretty much providing service to. And this allows us across the, not only the demographics, that also allows us on the chronic disease aspect, as well as the disparity and issue aspect, to break down and be able to be more meaningful when it comes to, highlighting the social determinant disparities, the issues in the diabetes, the issues in pregnancies, etc., and be able to then really truly narrow down to the challenges and the issues. And for us, we have been going out of our way to be more meaningful when it comes to collecting social determinant information, because not everybody truly understands the questions. Do you feel safe at home? Food insecurity? Do you have enough to eat? Because coming from different population, the amount what you have available can be very different. Let's just say, for example, Afghan refugees just come to the U.S. That is also getting some support from the resettlement agency as well as the local food bank. Their terminology of insecurity may be very different than someone who's more established here in the community and feels like they're not getting a well balance of the vegetable and fruit and meat and interpretation of what truly means to be food insecure. So we're very mindful when we're collecting the data to be able to also provide that educational piece of what does it mean to feel safe, what does it mean to feel the insecurity, and what does it mean for the rent, the shelter, etc. So that when we're collecting information, the information is a little bit more equitable across the board, so that there is understanding of what they're answering, and so we can be able to provide the support that they need. And with that, we're also very mindful of the population that we serve being migratory as well, because we had people who actually immigrate to the Greater Houston area mainly because of their family members and because of job, because of the different changes in socio-economical, especially during COVID. We're finding that they're moving to different cities, where they're moving all around the Houston area, which is so massively widespan. So we're constantly monitoring the different zip codes in the service area that we serve, to where the trend itself, people that are actually, demographics that are changing, the population, like neighborhoods that are forming. Are there more AA and HBI moving into this neighborhood, mainly because a new development, new job, new establishment of a chicken factory? Then perhaps maybe some of the newly arrived immigrants are actually moving towards that job opportunity in order to be able to better serve people who are migrating over to that area and be able to make sure that they have that continuity of health services that we offer. And with that, we're also very conscious to build bridges into those populations. So we hired advocates and liaisons. We have been working with the Association of Asian Pacific Islander American Organization, APIAHF. And so one of the projects that we had during COVID is to be able to have community health champions, advocates, as well as health workers, people who are well trained into understanding the resources, the challenges of the population, especially when you hire from within that community, whether it is the Burmese, whether it is the Afghan, whether it's Chinese, Vietnamese. We are mindful that if you hire from within that population, the information as well as the trust factor, the ability to be able to tap into the challenges, the data, the information is a lot more successful, mainly because you do have a liaison, you do have a person who can strategize with you to come up with language content, to be able to come up with appropriate verbiage for the word depression. Even some of the cultures, some of the population do not have a well term for the word depression. So you do need a liaison in that population to come help you really shape the question itself, including when we were coming up with the prepared module tool, working with APIAHF. We had really worked with multiple different liaisons, mainly because we had to translate it one way, the question into one way, so it makes sense to that population. Do you feel safe? Do you feel food insecure? Do you have reason for housing issues, or do you have other concerns, social, financial concern, right? So some population probably wouldn't understand certain terminologies, but having a liaison that understands the language, and if you basically say the different fonts, the different dialects, the AA and HBI population is so broad and just so multifaceted, to where even in Chinese, you have Cantonese, you have simplified versus traditional characters. So it's very complicated, and having that bridge and the support and the advocate and the champion that is part of your team to be able to carry out a lot of the in-language assessment makes a huge difference. So with that, I'm going to go ahead and stop sharing.
Thanks, Shane. I appreciate that. And I think you've captured really some great, some points to consider. Stella, you know, what about, and Stella, you've been doing research for a very long time. What are some of your process in terms of engaging community? What it took for you? What are the positives that you've seen from it? And still, maybe not even lessons learned, but what are still some of the areas that continually bring up some challenges when you're trying to kind of, you know, be thoughtful in how you move through those circles?
Yeah, thanks, Sheri. So I'll talk a little bit about our Harvest Share program, which is a community-based program I mentioned in Sunset Park, Brooklyn, that serves English, Spanish, and Mandarin-speaking families in Sunset Park. And I'm going to tell you a little bit about some of the lessons learned. Like you said, I've been in the space. I've been privileged to work at CSAAH and work with many of you on this call in terms of implementing community-based projects. But there have been some particular lessons that have come out of this project that have been really exciting to learn about and to embrace, and to really, my whole goal is to try to launch some of these lessons into the public. So the Harvest Share program is a 5-pronged program where we are aiming to improve diet within immigrant communities in Sunset Park. And the 5 different prongs are food access itself. So we provide through a subsidized, culturally appropriate produce box, fresh produce box that is grown by 2 of our farm partners. We feature Mexican and Chinese specific cultural vegetables. So we do food access, we do nutrition education, so linking people to some of the vegetables that may be unfamiliar to them, providing them with education and materials and recipes to be able to prepare some of these ingredients in ways that are culturally appropriate for the tools and techniques that they have in their own homes already. The 3rd pillar within Harvest Share is experiential learning. So we do a number of farm tours, we do gardening workshops, cooking workshops, and all of these different workshops, they may focus specifically on one specific language, or some of them are actually multilingual. And so they're being held in different languages supported by our research team. The 4th pillar is thinking about economic security, which is obviously an important driver of food security. And also, lastly, we try to align all of our activities to local food policies. There's a very robust New York City and New York State food policy scene. And in fact, just a few months ago, New York State has passed a Medicaid waiver to cover food as medicine programs. And so for us to be able to be aligned with some of those efforts is really important for us to understand the potential for sustainability in the future. So, but just to build off of what May was saying, and I think in terms of building the infrastructure itself, I think the first element that I would want to talk about is timing. Like, I think a misnomer in a lot of health equity, quote unquote health equity or community partnered research, is that the community engagement part comes after you've gotten the grant and after you've designed the whole thing, and then suddenly we need the community to recruit. And in our mind, and you're all smiling, because again, I'm like preaching to the choir, but like in our mind, it's like the community engagement part should be coming like from when the actual ideas are being generated, right? Like I see this time and time again where researchers pick an evidence-based intervention, they culturally adapt it, they translate it, then they start their community engagement, and then they don't understand why nobody wants to participate. But the reality is that process of picking the intervention, going with what is actually the priority of the community, that comes like years before the grant actually materializes. And so to put some of those comments that May was sharing together, it's like you have to show up, and a lot of this work is being done in kind, right? Like you just have to show up, you make meetings, you talk about what priorities are. And in the case of Harvest Share, what we were able to do is I started talking to some of the partners on this grant. So it's an R01 funded grant that received funding in 2023. But I started talking to these folks in 2019. This is even before the pandemic. So just talking like, hey, you know, what are your priorities? What are our priorities? And for it to really be a bi-directional relationship, not this top-down academia is coming in with money, what are you going to do for us kind of model, but more like, what do you do? What's your organization's priorities? This is what we do. These are our organization's priorities. And I always feel like Harvest Share is like, I don't feel like I do feel like we built this program now to collectively together over all these organizations. But I do feel like it was just like all these different pieces were in place already. We just came in and put a little system on it and gave them some money to do it. It's like amplifying what is already going on in the community, right? And going in alignment with what the community-based organizations or multi-sector partner priorities are. And I think so the timing part of it can be really hard when you're starting out in academia because it has to be in kind, because it has to come so far in advance of your first pilot award. But it's not impossible, you know, like this is something that we talk about all the time with our junior faculty, with our pilot awardees within our center, is that you have to start with a conversation and you start, are our priorities aligned or not? And to also I hate the word humble, but also be humble, like your priorities are XYZ as a junior faculty member. Their priorities are not your priorities, and there's nothing wrong with that. It's okay for them to coexist. And so I think building systems and relationships where those priorities can coexist and where everyone can benefit is probably the first thing that I would share. And then I think the second thing is going back to representation. We've worked really hard in the Harvest Share program to make sure that our team is diverse and represents each of the different communities that we're trying to reach. So I mentioned we reach English, Spanish, and Mandarin speakers. We have a budding reach within the Bangladeshi community and Bangla speaking individuals. And within each of those language groups, we have a faculty member, we have a bilingual coordinator, we have like 2 to 3 bilingual student interns, we have a community partner, and we have community members. And it's not like one token person for this group and one token person for that group. It is this meaningful building of our team where we are able to reach. And I will tell you that this is my first experience in running a program of this scope. And I think that brings such a richness and matchingness of the research to the community you're actually trying to reach. And I love to share this, like, we're now in a different recruitment phase, but for our pilot, we recruited for 40 spots in 4 days. Like, and people were like, how did you do it? And it's everything I just shared with you, right? It's like we picked an intervention that we knew folks would jive with, but we knew that it had never been designed for them. So then we culturally adapted it, we translated it. All of our team members are, you know, are commenting and creating on different aspects of the recruitment process so that the whole thing feels natural. The whole thing feels like something that somebody would want to be a part of, right? Like, so the bottom line is by having a diverse team and by doing all that groundwork, you can actually create something that people want. Like, it's not just about like coming in and being like, hey, this is the best science. You should want this because it's the best science. It's like, no, we thought about all these other aspects and this is something that you want. And we see that reflected in our recruitment and retention. So thanks.
Stella, thank you, because I think you're also, you're painting this picture of something that seems so unrealistic and not the norm. And I think that this is kind of the movement and the shifting of the narrative, right? And I think, again, the people on the call are like, absolutely. But I think what's happening is we're there and we're waiting for everybody to recognize that this is the norm. And so I think oftentimes with researchers and those wanting to go into research, I think it does start when they're in that space in academia. And I think there needs to be classes, courses, or integration of conversations in those classes that talk about how we behave, what works, because I think there are still many folks that are in that old school thinking of how we do research. But I think it also doesn't help when funders are still not yet pivoted to this new way of funding of creative funding, of community-led funding. I think, and so I don't think all the parts have gotten to the place where maybe some of us are at, and we're just kind of waiting at the rest stop as people keep coming in and really, and I think it's also us celebrating that this is where the direction of research has to go. It's not about let's figure it out and try it on. It's this is the direction that we need to go. So I think that's really exciting for us to have these conversations, because I think we get very excited. We come, we hear like, oh my gosh, Stella's doing this, or May's doing that, Shane's seeing this, and oh, we're so excited. And then we see, you know, grants come out, and it's like, oh, where is that? Oh, how do we fit it? Because I know that in many federal funded grants, food is not allowable, right? And so then you almost feel sneaky to talk about, you know, food policy, food sovereignty, food as medicine. And it's like, we shouldn't have to. We should be just saying that there's, you know, food culture, cultural foods that help our community thrive. And it's helping them understand what that is. And so it's interesting that we're having these conversations and wondering how we can bring others along that need to be brought along. And so, Neen, what from your perspective, what are you seeing? What are you experiencing?
Yeah, thanks, Sheri, and great to hear everyone's thoughts on this question. So 2 things I wanted to talk about on this topic from the Health Forum end is, one, our National CBO survey that we sent out, and our National AA and NHPI Health Response Partnership as well. So I'll talk about the survey first. So just to give a little bit more background, the Health Forum works with what we call our national network of community-based organizations. And currently our national network consists of over 250 AA and HPI serving CBOs in 43 US states and jurisdictions. And we really leverage our national network in this work in public health and health equity. So an example of this is during the first year of the COVID-19 pandemic, the Health Forum sent out the first iteration of our CBO survey to over 100 AA and HPI serving CBOs, really to hear about how COVID-19 in particular was affecting our communities and the work that our CBOs do to serve our communities. And then from that, every year since then, we've released a more general kind of comprehensive national CBO survey that explores the different programmatic priorities and advocacy needs and challenges that our CBOs report when they respond to the survey. And then going off of that, you know, some of the challenges that we learned and some of the lessons learned. So during that time as well, during the pandemic, we also created what we call our National AA and NHPI Health Response Partnership. And through that partnership, we were able to collaborate with 29 different local and national AA and NHPI CBOs. And this was also in support with the CDC. And that health response partnership focused on creating resources on for COVID-19, specifically around vaccination awareness and data collection efforts, and creating different public service announcements and health education. And I think the lesson learned from that was, you know, unfortunately, it took a global pandemic to bring us together. But one of the greatest lessons learned is, it's a cliche, but, you know, we really are stronger together, and it truly takes a community to do this type of work. And I think that's kind of like the main important thing that we learned, is just when it comes to advocating for health of our communities, working with one another and building coalition of community partners to share the work and successes. And of course, the challenges is really important.
Thanks, Neen. So we're approaching 9 a.m. I want to make sure we leave space for any last thoughts. But Stella, you mentioned the word meaningful engagement, right? And so the kind of wrap up before we go into Q&A is if each of you can, because I want to kind of push it to value. The things that you're doing, the partnering that you're engaging in, you know, being mindful on timing, on all of these things, right? Coming to community when they might not even recognize that they have a thought of how they could partner, how they could do new things, research new ideas. what did you bring of value to your community? So the work that you've done, what is that value? What is that meaningfulness that you brought to community, or that community brought forth in you? Because I think that's really important to talk about, is it's a reciprocal, it's not a one-sided. So what is that value that came from this partnership? So that's question one. And two, one piece of advice that you would give either to a community or to a researcher, somebody who's listening in today, one piece of advice that you've learned, whether through success or through like falling on your face and picking yourself up and dusting off and going, okay, probably won't do that again. So those are the two things I'm going to pose to you. And I'm going to start with Shane. So what is the value that you brought or was given to you from community? And then what is your one piece of advice?
So often on coalition work, we're mindful that the amount of resources, any particular project, any particular funding, you have to be equal when it comes to allocation to the different partners that is, taking part in the reach and the data collection, et cetera. But then we're also mindful that as any project itself, certain group may need a little bit more support and resources than one particular group. And so we're constantly mindful that aside from what on the equitable aspect, that you do need to prepare and have resources, additional education, coaching, advocacy training, meaningful conversations with the community leaders, and time invested when it comes to certain population in order to be able to really help them elevate and get to the level of readiness to take part in the activity as well. Because some of them may, have a little bit more challenging when it comes to why do I need to take part in this? And also being champions for their community. They may need a little bit of help when it comes to what is advocacy versus what is lobbying, what is appropriate to say, what is not appropriate to say, and how to tell stories from their community. Some population are a little bit more hesitant and distrustful when it comes to sharing their stories from their population. So having to spend that time to gain the trust and having the engagement itself is actually really key to one of the success of making sure that your project itself is equal across the board and you're really making that impact.
Thanks, Shane. Stella, what about for you?
You are such a good moderator, Sheri. Okay, so I think in terms of value, I'll talk, and Shane, you touched upon this to some degree, but I think it's important, and I think May had also mentioned this, like it's important for that monetary reward to be very transparent and equal, and people should be compensated for the expertise and knowledge that they bring. And the definition of expertise and knowledge differs across many different things, and there are certain specific definitions that are applied within funding and academia, but those are not necessarily what I'm talking about. And so I think that really being open and honest about budget and having that open communication, being transparent, having back and forth conversations has been really important. I think in terms of the value that I hope the program is bringing to the community. So one of the things that really speaks to my own lived experience is just this idea of not feeling like I belong in this country. And I really love that this program has opened up a space. It's a rooftop farm that was previously, it's been there for 10 years, but it's previously a space where people did not feel welcome because there were no people that looked like them up there. There was no people that spoke their language. And so, now they're growing foods that are appropriate for the community as well. So I think that my long-term hope is to utilize programs in public health to build spaces and places where people feel like they belong here, whether they're immigrant or Asian or Native Hawaiian Pacific Islander. And I think that the one piece of advice I have is, I have a 17-year-old, I kind of liken it to having a teenager. Like, you can't be afraid to have uncomfortable conversations. It doesn't matter like how trusting your partnership is with different organizations or individuals, there will always be misunderstandings. And so, you know, you may not always, when you first start out working together, everything might be humming along and it's fine. But from my sense, like, I just feel like it's very important to create the space where if people feel uncomfortable, they should feel comfortable enough to be able to come and like tell you those things and to have an open discussion about it. And I mentioned the teenager because, like, having a teenager, you have all these uncomfortable conversations and you're like, well, it has to be done to maintain the harmony of our household or to maintain the harmony of the relationship. So I think listening, being open, you know, having uncomfortable conversations, whether it's about money or priority or staffing or whatever, differences of opinion, I think that those are all really important lessons that I've learned.
Me, what about for you?
A couple of things, or maybe it all centers on the issue of reciprocity, which I'm learning, and I continue to learn from our community members and our community organizations. So it is an honor and a privilege to be doing research in the community. And I think in terms of, they give a lot, you know, anytime a community organization or community member participates, it's not just that maybe we're giving them some funds for FTE. They're bringing along with that all their history and their experience. And I don't think that's appreciated nearly enough. So in what does research bring to the community, you know, in the format, it sounds like all of us here on the call do. We try to strengthen the research infrastructure. We try to mentor and bring along community members, especially the young community members. So we've had opportunities for volunteering and for paid positions, and many of those have then had we were able to link them to other academic faculty in their pursuit of higher, I shouldn't say higher, but more academic careers, like nursing school, medical school, other professional educational opportunities. But I think on top of that, that we're trying to explore are other ways that academia, other organizations outside of the community can bring value to the organizations to help strengthen them. So, you know, our research team from the community members can teach graduate students about qualitative research because they've done so much of it. But it's the graduate students who get a degree and our community members don't. You know, it doesn't seem like that there is reciprocity there. And so we're trying to figure out, like, how do we make it so that with research and these activities that we're doing in the community, that we can strengthen the organizations. So I think the issue about value is an ongoing conversation on how we can do better.
Thank you, May. Neem, what about for you?
Yeah, thanks, Sheri. I think for this question, when I think about the work that the Health Forum is involved with, the value that we try to bring is just trying to advocate on behalf of, you know, the community partners that we work with. You know, some of us were talking about just the availability of different resources, and some of the community partners that the Health Forum works with are, you know, more locally based, and knowing that some CBOs don't have the same resources, or the available resources aren't as widely available to them. That's something that organizations like the Health Forum, you know, more national orgs can kind of help to fill in those gaps where it comes to advocating, for funding for other orgs, and some of the priorities, in particular in policy areas that we haven't talked about yet on this panel, but when it comes to like advocating for language access at the federal level and again, advocating for funds and data disaggregation, I think that's kind of the value that we can bring. And then I guess the one piece of advice that I would give, and this isn't to the researchers that are on this call, but researchers that are a little bit more outside of this work, is just keeping in mind and being inclusive to the varying and different voices within our AA and HPAC communities when it comes to health research and health equity.
Thank you. Before we open up for Q&A, because that's kind of where we're at, we've got about 8 more minutes. I wanted to just kind of wrap up some of the high points that I heard. Definitely reciprocity, but I think beyond just the immediate, I think we all can agree that what we get goes beyond the research period. Right? When we look at these long-term relationships that are created based on just, spending time, sharing space, helping communities amplify what their needs are. So Stella, the investment you made into your community, into that community around, that food, the work around food and what that looks like, you're going to be reaping those rewards well beyond the ending of a contract. And I think that's also the part with reciprocity, is recognizing that the gain on both sides can extend beyond, and then that is what helps you bring in the next generation of researchers, whether academia or community, because I think we still need both sides to have those spaces and relationships. So I heard that. I also heard timing being, huge, but I think also timing talks about not the one size fits all. I think we all represent very different communities that for some may consider very complex, right? In relation to each other. And so it's also not all size fits all. And how do we also advocate so that funding and opportunities are made available that can fit all of us? And in some cases, we have to also look at even smaller communities that are not yet on the form that we're tracking, Shane, correct? Because I think you shared a form, and I know that SPD 15 new conversations remove some of that and expand some of that, but it's also how quickly are our federal partners going to pivot to make their plan known on how they're going to implement these new changes in SPD 15. And so how do we stay on top of that along with all the other work we do? And then, so I think those things are what I heard. I know for our participants listening in, we are going to provide some of our email addresses for our panelists. I think Shane did provide hers already, so that if you guys want to know more, you have a question for Stella or for me or Shane or Nan around things that they talked about, or maybe they didn't talk about and you're curious, you can also reach out to them. We have about 5 minutes left, and I want to open it up for Q&A. I'm not sure, Victoria or Celine, if we had any questions from the audience. I think the 2 questions we did have, or comments we did answer. We don't have any questions. So you know what, for the last 5 minutes, I'm going to open it up to any of our panelists. If you have any closing comments, closing thoughts, they've all put their emails into the chat for those participants. If you can see those, please make sure you capture that. Does any of our panelists have any closing comments, thoughts? You've got like a minute. I know I'm keeping you guys contained.
I definitely want to share that my fellow colleagues and fellow panelists, I pointed it out really well. about the opportunity to create internships and the opportunity to make sure that there's learning opportunities for the next generation of college students, researchers, people who are going into health profession. It's really important that they join our journey into a lot of these research and community engagement, so that there's also some continuity. There's an expansion, there's work that will continue to be done, way beyond into the future, and hopefully broaden the in-depthness and the wealthness that we're able to do today.
Absolutely. Thank you, Shane. Stella, I see you unmuted.
Yeah, I think I'll just add that I have been, I mean, even May and Shane, I think on this call, like have been the lucky recipients of these community-led research awards by the NIH. And so I know that there are systems in place that are, it's like turning a big ship, right? It takes a long time to turn them, but I have been heartened to see the federal response to our communities and in this administration. And I think, there are different funding mechanisms. They're certainly the minority, but for example, like the UG-UH3 mechanism is a new NIH grant mechanism where the UG phase is 2 years of planning and then 5 years of implementation. Like, that's cool. That's exactly what we've been talking about for the last 10 years. Like, this takes time, it's in kind, like we need time to build these relationships and trust. Like, so I think that the tide is turning. The other thing that I feel hopeful about is the more that, like, I watch the younger generation, like the Gen Z generation, and I'm so impressed with like how forthright they are in being proud of their identities and wanting to bring that identity into their workplace, into their professional life. And in that sense, I think together with what you were saying, Sheri and Shane and May, like if we can really amp up people's understanding that they are actually part of the research narrative too. It's like, for I think a lot of students that I talk to, they don't recognize that their experience and their family's experience is something that matters in research, and it's just not correct. So I think the more that we can encourage that along the entire pipeline of young folks, and show that in a professional setting you can bring your full self and even make things better for others is I don't know, it should be a goal for all of us, I think.
And with that, I think we're going to leave today's, Nan, unless you or any, May, I'm sorry if I cut you off, if you guys have last parting words. But Nan, did you have a parting word? No.
Nope.
I think I'm going to leave it with what Stella says. Bring your true self. Bring your most authentic self. Even if it's messy, even if you don't think there's value, there is. And that's important. I don't think we say it enough, and maybe it's about giving permission for all of us to bring our authentic self, and engaging in those conversations often in spaces that we don't think we can, but we should. So Stella, I'm gonna leave it with that, with those wise words today. And I really want to thank everyone for coming, joining us today, having this conversation. I know it's a full day of other breakouts, and I hope everyone continues to enjoy the opportunity to learn, to connect, and just uplift the work that you're doing. And I'm going to pass it back over to Jennifer.
Perfect. Thank you so much, Sheri. And thank you to all of our panelists for joining us this afternoon. The time went very quickly, but just thank you to all of you for holding this space and having this conversation, speaking to passion of equity. I will leave it with Stella's last words, but thank you again to everyone for attending and joining this session. We hope you join us for our next session, which will be our second flash presentation session. I'm going to just add that to the chat if you'd like to register and don't have the link. But otherwise, thank you again for your time this afternoon and this morning. But yeah, take care and be well. See you soon.